Hi guys, Dr. Shaun here. So this month is Children's National Dental Health Month. So it's a month where all dental professionals come together to promote the importance of your children's dental health. So I do have a couple questions that are probably the most common questions I have from parents that are patients here about their children. So I'm going to go over some of those questions with you today. First question is whether or not children can be born with teeth. In fact, yes, they can. They're called natal teeth. Now, there's no issue with children being born with these teeth except for the fact that it could be uncomfortable when a mother feeds, or if for some reason it's bothering the child themselves, then the dentist may opt to pull these natal teeth out. But it's not that common, but it definitely is possible to have children born with teeth. Another question is, when should you brush your children's teeth? So it's very easily, as soon as you see any sort of tooth structure pop out of the gum, that's when you want to start brushing your child's teeth. So some parents like to use one of those soft finger brushes. On both my kids, actually used the burst brush because it's pretty soft. So it wasn't damaging to the tooth structure or the gum tissue. Obviously I didn't turn it on, but I just used the brush itself to just brush whatever tooth structure I did see. The next question is, when can your child start brushing their teeth on their own? So basically, as long as you're watching them and they're hitting every single surface of every single tooth, you can kind of basically let them go on their own and brush their own teeth. But it's something you kind of have to watch for a while, because a lot of kids will say they brush their teeth, all the surfaces, but they don't really. So you kind of have to keep an eye on it. Every kid's different. Obviously, the more developed a child is, the more capable they are to reach all surfaces. So you just have to keep an eye on your child. Once you feel like they're doing a great job, you can go ahead and let them go ahead and do everything themselves. Another question, actually probably one of the most common questions, is when a parent asks me when their child should go see the dentist. So I always say the sooner the better, but obviously you want to wait until one of the first teeth erupts, okay? It's not only, there's usually nothing's gonna be wrong, but it's about just having the child form a relationship with the dentist and getting them in there early enough so they're not scared of the dentist and they're excited to go. So it's basically, the first visit usually is just more like a meet and greet, but definitely as soon as you see the first tooth come out, go ahead and just schedule a dental appointment. Sometimes I get asked if I see children here at the office. If I'm already seeing the family, some older brothers and sisters, I go ahead and tell the parents I can go ahead and see them. But usually I like to refer them to an actual pediatric dentist. That's a specialist, just like any other specialist I refer to. The pediatric dentist is a specialist. They have a special skill set to treat children. Anybody younger than 13 or any difficult children patients, I go ahead and just refer to the pediatric dentist. And one last question is when your child should graduate from a pediatric dentist to an actual general dentist. So I always say I prefer, if they've been seeing this pediatric dentist since they're little, go ahead and have them see them until they're 18. This pediatric dentistry has seen every milestone of this children's dental health. So as the jaw and teeth are growing, which is usually stops around 18, 19, they might as well just see the same pediatric dentist. So remember, February, National Children's Dental Health Month. Go out there, promote, let people know how important it is that children see the dentist. We want to get them to start pretty young because we want them to start forming a relationship and see how important it is that we have good oral hygiene habits. So go out there and make a difference. Alrighty, bye guys.